So, Trail 4 is buried boulevard, which are the transverse processes of the thoracic and lumbar vertebrae.
Thoracic, lumbar, okay? And we're gonna go into the lamina groove, correct?
Well, the erector spinae.
Okay.
So your partner's going to be prone.
Yep.
You're going to locate a portion of the thoracic spinous processes, wherever you want to go.
C7, right here.
Mhm.
Okay, so when I get to here, I'm on T1, okay?
All right, and then you're going to move roughly 1 inch laterally, and that's where you sink your fingers through the thick erector spinae muscles.
Okay, so I'm going to slide towards me, and I'm gonna keep my fingers pointing at a 45-degree angle. So I'm directly heading into the lamina groove. Okay, so I'm actually medial to most of the erector spinae. I'm not going, actually, not really going through them, but, okay. What's next?
And then if you move a little bit laterally, that's where you hit the transverse processes, but they're going to be difficult to palpate.
So, spinous process, slide 1/4 inch to a 1/2 inch lateral at a 45-degree angle. I'm sinking into the lamina groove. If I slide another 1/4 inch or so, then I do a superior inferior, I'm sliding over top of the transverse processes. You're gonna be palpating through the erector spinae, so it's not gonna be as prominent as you would like it.
Next, we're going to go to the lumbar transverse processes. You're going to locate them and slide roughly 2 inches laterally to avoid the thick mound of the erector spinae muscles.
Okay,
And
so,
then-
go ahead, sorry.
Then you slowly sink your fingers through the muscle tissue, directing your pressure at a medial anterior angle, as though towards the navel. Explore for the tips of the transverse processes.
Okay.
Because
So-
of the thick overlying tissue, the individual processes might not be directly palpable, but try to sense the solid ridge they form.
Okay, so I'm gonna find the 12th rib. I'm gonna slide in. I'm on T12. If I slide down 1 vertebrae, or about a 1/2 inch, I'm gonna be on L1. Okay, spinous processes right in here. If I slide a 1/2 inch, 1/4 inch, and come in at 45, I'm in the lamina groove. I need to slide another 1/4 to 1/2 inch, and I'm gonna be palpating through the thick erector spinae tissue. It's very challenging to palpate the specific transverse processes, but I kind of come straight down and I hit that hard end, which would be the transverse process.
All right. Now you're going to look for the lamina groove of the thoracic and lumbar vertebrae.
Okay, so this is kind of a review because I just went over it. Spinous process, slide 1/2 inch or 1/4 inch lateral or towards yourself. Your fingers should be pointing at about a 45-degree angle, okay? And you're gonna feel some soft tissue in there, okay? So you're not gonna feel hard bone like you would if you were just palpating the spine. If you slide back towards the spinous process, you're gonna feel the lateral edge of the tip of the spinous process, and then you need to slide slightly back and sink in, okay?
Okay. Try the same method in the lumbar region and observe how the lamina groove widens and deepens, and how the muscle tissue is thicker in this region. Compare with the muscle tissue in the thoracic.
Okay, so lumbar spinous processes, these are larger because they're more weight bearing, okay? Geared towards weight bearing. I'm gonna slide a 1/2 inch lateral, again, a 45-degree angle, and I can sink in individual fingers or 2 fingers at a time. I'm gonna be sinking in a little deeper because of the size and the thickness of the tissue. When I get to the bottom here, I'm gonna come into the top edge of the iliac crest, okay?
Next trail is breastbone ridge. So your client will be supine for this.
Okay, Trisha's gonna lay on her back. Okay, go ahead, Ralph.
And the first thing you're going to locate is the jugular notch, the manubrium, and the sternum. So
Okay.
you're going to place your fingers upon the sternum at the center of your partner's chest.
So the jugular notch is that U-shaped hollow at the top of the manubrium. The manubrium is the top of the sternum, the thicker part of the sternum. And then as you slide down, you get into the sternum, okay, which also known as the breastbone.
You're going to slide, which you already did, superiorly until you reach the jugular notch at the top of the sternum. Explore the notch and its locations next to the sternoclavicular joints. Move your fingers inferiorly off the jugular notch into the manubrium and the body of the sternum. Explore any crevices or hills upon this flat bone. Also palpate laterally towards its attachments with the costal cartilage.
Okay, so if I'm directly at the midline of the sternum and I'm gonna slide away from myself laterally. I'm gonna slide onto the ribs, okay? Or I'm gonna immediately palpate the costal cartilage, and then if I go a little more lateral, then I get into the ribs, the bony part of the ribs, okay? And I can do that all the way down. Notice when I get slightly lateral, also I'm going to be in the attachment site for the pectoralis major, okay? So this area may be slightly sore on some of your partners, okay? When I get to the bottom here, go ahead, Ralph.
Okay? You're going to slide your fingers inferiorly until they drop off the sternum and fall into the muscles of the abdomen. And now you're going to backtrack to the most inferior tip of the sternum, which will be the xiphoid process. Gently sculpt this tip.
Okay, now not everybody has a xiphoid process, okay? Xiphoid process is a small bone at the bottom of the sternum, okay? Feels like Sue does not have one, okay? Although I do, so I will show you mine. Sternum. The tip of my xiphoid process is right here. Okay? This is an attachment site for the rectus abdominis muscles also. Okay? What's next, Ralph?
Trail 6, one bumpy road, which are the ribs and the costal cartilage. So we're staying supine. Slide laterally from the sternum onto the costal cartilage. Use your fingertips to locate one costal branch and palpate its rounded surface.
Okay, so midline, I'm going to slide laterally. I'm going to slide down below the breast tissue, and if I spread my fingers like this, I can feel the individual ribs. Okay, I can also feel the space between the ribs where the intercostal muscles would be located. Okay? Any soreness there? Good.
Okay. First rib.
First rib. Okay.
If the partner supine, soften the overlying tissue by passively elevating your partner's shoulders.
Okay.
Locate the clavicle and the upper flap of the trapezius to identify the posterior triangle. Place your thumb pad between these structures.
There's the posterior triangle. Okay.
And slowly sink into the tissue of the scalene muscles, directing your fingers straight in an inferior direction towards your partner's feet. As your fingers sink into the tissue, you will meet the solid resistance of the shaft of the first rib.
Okay, so you come over this way just a little bit from the top. I'm gonna slide directly inferior. Okay. Now I'm not gonna hit a hard bone, but I'm gonna hit a hard end, and that would be where the first rib is. Any soreness there?
No.
No? Okay.
And you can ask your partner to take a slow, deep breath into the upper chest.
Take a deep breath.
Can you feel the rib rise?
And I definitely feel the rib rise. Okay? Good.
Next, we're going to go down to the 11th and 12th ribs.
Okay?
They are called the floating ribs because they don't attach to the costal cartilage. So your client is going to be prone for this,
Okay, prone.
the other prone.
Yeah. Okay, Andrea, let's lay on your stomach, okay?
Yep, sounds good.
All right. There we go. Right there. All right.
Reaching across to the body's opposite side, place your hand along the lateral portion of the ribs and slide inferiorly to the bottom of the rib cage, allowing your hands to sink into the soft abdominal tissue. Compressing your finger pads into the side of the thorax, explore this region for the tips of the 11th and 12th ribs.
Okay. I think it's easier to find the 12th. Okay, so I'm going to find the 12th rib first. Okay. And then I'm going to follow that laterally till I get to the tip. Okay. And I can feel the tip of it right here. And then I'm going to slide slightly lateral and go to the 11th. And I'm on the 11th right now. I'm going to slide more lateral until I get to the tip. Right about there. Okay? Good. Why don't we
All right.
stop there and then we'll go on.